I'd like to ask you permission to use this video for educational purpose and on internet. Now, I'm going to come to the point. The sacroiliac joint for many, many decades used to be an unknown entity. We didn't know it, we didn't know how to diagnose it, we didn't know how to treat it. For the last 10, 15 years, finally we figured it out. And you're an example of that. Like, first of all, your surgery was just 3 months ago with the sacroiliac joint fusion. And how bad was your pain before that?
8 to 9.
8, 9, 10?
Yeah.
Wow. And because that is what my documentation says, that your pain was 8 to 10 with activities and so on. The surgery was 3 months ago.
3 months. March 28th.
Yeah. Did you stay in the hospital or did you go home same day?
Went home same day.
Same day. Now, how bad is your pain now?
2 to 3.
2 to 3. And tell me about what activity can you do, what can you do, and what are you doing? Because that is the amazing part of it.
Most of my physical activity has been, I might sweep the garage, I plant the garden, I mow the yard, I walk behind the mower, and I ride the mower in a bumpy yard.
So you're almost a farmer.
Kind of like that.
Like a hobby farmer.
I've been keeping very physical without overdoing lifting or heavy things.
Yeah. But you told me you're doing 8, 9 hours of yard work daily.
Yeah.
And this is good for your heart, good your activity and so on. Obviously you have to be careful, but it's just the fact that 3 months after the surgery, you're able to do 8, 9 hours of yard work. That's by itself amazing.
I basically do any activity that I want to do. I just limit myself to not excessive.
And that is a smart move.
Right.
Now I'm going to turn around and show. This is what we did. And your bone is actually growing beautifully inside of the screws. And as well, it starts to making connection outside. That is amazing. This is, after just 3 months, it's amazing that the bone is growing so well, so that you have a good healing process in your back. But as well, I want to show the other side. The other side is growing by itself. If you remember, we talked about that half of the people that we fix one side, actually they use that other side, take the stress off the other side heals by itself. But half of them we have to go and do the other side. I'm very happy to tell you that I think you're in that half that the other side doesn't need to get done.
Yeah, because that's one of the things I was worried about. You were going to say, well, if you still have a little bit of pain, maybe we have to do the other side.
No, you see that that is, our policy on that is anything that anything else can fix should be fixed by anything else. And surgery is the last thing on the list of the things you need to do.
Yes.
And you having 3 months after surgery some symptoms with activity is absolutely normal. That's nothing that we should jump to surgery at all.
Yeah.
We should help your body. You have a good common sense, and you say yourself you're not going to do excessive thing, and your body will tell you. I think if we give it time, I think we will be fine. Okay.
I finally retired June 1st.
Good, congratulations.
And I bought a motorhome, so my wife and I will do some traveling.
Excellent. Well, I'm hoping I can make you independent, and I'm hoping that you'll be good enough to enjoy that motorhome to the fullest.
You bet.
Okay, thank you so much.